Many patients in Zanzibar flock the Seblem Primary Health Care Unit for treatment every day. Women with their little ones in tow are a constant sight in this small center. Most of the children are under 5 years. The first impression one may get is that they're suffering from malaria, which is a wrong impression. While in Uganda, malaria easily attacks and kills children under 5 years of age, in Zanzibar, it's a different story altogether. It's rare to find a child under that age with this disease.
In percentage, malaria in children approximately 0%.
Statistics from a recent study put the prevalence rate of malaria at 0.03% for all age groups.
We have some places to date, for the last 2 years, they've not reported a malaria case.
The situation has actually changed in Zanzibar. It's now school pupils above 5 who occasionally get infected.
We are trying to find out what are the reason behind, and we're also doing what we call the mosquito behavior monitoring.
A visit to the main hospital in the pediatric ward attests to this.
Someday, I think 6 months ago, we had some cases, one case with malaria positive, but this child comes from Tanzania mainland.
Malaria in Zanzibar is currently neither among the top 5 diseases nor the top 10. Yet only 8 years back, it was one of the top killer diseases.
Even it leads some of doctors now, they start to forget how to treat malaria because it's not available now.
But when they get impatient, they have treatment guidelines.
And we use 2 drugs here, artesunate and amodiaquine, combination therapy. And amodiaquine is 10 milligram per kilogram body weight and artesunate 4 milligram per kilogram body weight.
The SCT mostly used in Uganda is Coartem.
And the first line is a combination of artemether and lumefantrine. And for severe malaria, we are using as first line artesunate, parenteral artesunate, meaning it has to be given intravenously.
We have quinine, but we spare quinine. In our day, we use most of the time we use artemether injection.
Any co-infected patient, I ask.
I don't remember. We don't have this.
But why worry about co-infection when malaria is getting totally wiped out? Pregnant women are now a worrisome group to health experts in Zanzibar. But even then, only a few of them are reported. In February this year, the antenatal department at Seblem Healthcare Unit recorded only 2 malaria cases. The number rose to 4 in March. The authorities at the Mnazi Mmoja Hospital are always checking slides at the malaria diagnosis unit, despite the low levels of the disease.
Sometimes we collect up to 50 and no positive. And sometimes we collect 20 and we get a positive 1 or 2 per day.
He says that under 5 rate of positive is too low. This chart in the lab clearly shows the prevalence of malaria. For example, in January 2013, out of over 1,025 children examined under 5, only 1 was found positive. In April and May, out of over 300 examined, none was positive. A far cry from Uganda, where almost 6 are found positive out of every 10 children you may see at a given time at the hospital. At the main hospital, they collect slides from other health facilities as well. But the main lab at Zanzibar Malaria Elimination Program, ZAMIP, takes the hospital slides, as well as from health facilities across the country, including some from private ones, for further scrutiny.
Kufanya quality control.
So do you ever find a positive which is negative?
Somehow, sometimes.
The number of those detected with a parasite is very low in Zanzibar, which indicates a journey towards the elimination of the disease.
On a yearly basis for the last 5 years, we are now having not more than 5 cases, 5 deaths reported at hospital levels.
He, however, says the intervention has drained their resources.
It's a process whereby a number of things need to be in place. Health system need to be strengthened. Community roles need to be defined clearly, and many other factors.
They still have quite a number of mosquitoes.
Having a mosquito doesn't mean that you will have a lot of malaria. It depends on the stages of infectivity.
In Uganda, however, there is a park district in northern Uganda known globally for having the highest number of infectious mosquitoes, with one person getting bitten by about 1,500 mosquitoes annually. The ongoing indoor residual spraying has helped in reducing them. The few patients found with malaria in Zanzibar are thoroughly followed up right from the hospital to their homes. One of their policies is to test all fever cases in the country. same as Uganda's.
The issue of treating blindly is no longer accepted.
Symptoms of malaria, as I mentioned, fever, headache, joint pains, general body weakness, they are vague symptoms. They're symptoms that a patient with any other disease can present with.
The U.S. President's malaria initiative, started by President George Bush, as well as the Global Fund and other organizations like the Liverpool School of Tropical Medicine, greatly helped Zanzibar reduce malaria. What they consider a milestone, however, is the fact that they were among the very first few countries to use anti-malarials when they had first been introduced on the scene. This contributed a lot to the cure rate of patients and decreased parastemia in the population.
So what are you doing to ensure that you never have such a scourge occur again? Or is it something that you don't worry about?
No. It is, we do worry because there is also a risk of resurgence. You see, and usually when it resurges, it comes back with a vengeance. You see, it comes very severe because most of the children born now will have no immunity to malaria.
Since the few identified malaria cases are imported from other countries, including Tanzania mainland, they would love to test everyone who comes in at all entry points. But it's a big undertaking which they're thinking of implementing in the future. For now, they continue to strengthen the existing WHO recommended measures, including use of nets and continued surveillance of the methods in place. Florence Naluyimba, NTV in Zanzibar.